Toxicology. Now we're talking about the things we put into our bodies interfering with our body's ability to do things. Usually when we're talking about toxicology, we're talking about illicit drugs, all right? But a lot of this is also going to refer to abnormal effects to drugs that are good. Toxicological emergencies comprise 9% of all emergency calls within the EMS system. In order to quickly identify the toxicological emergencies, you must be able to recognize the most obvious signs and symptoms of that specific classification of drugs. So we think of cholinergics, anticholinergics, opioids, sympathomimetics, GABA agonists, opioid withdrawal, hypoxia, hypoxemia, hallucinogens. Lots of different classifications of drugs. Cholinergics are going to call what we call sludgem, right? Or dumbbells, salivation, lacrimation, urination, defecation. Basically, everything that's you're going to be leaking out of every single hole is the idea behind cholinergics. Anticholinergics are going to dry you out. Opioids and opiates both will depress your central nervous system, whereas sympathomimetics will mime the effects of the sympathetic nervous system, right? So sympathomimetics, they're miming sympathetic nervous system. So these are going to be uppers, basically downers for opioids and uppers for sympathomimetics. Everything else is going to be withdrawal from those things, or hallucinogens, which are their own classification. So again, cholinergics or organophosphate poisonings or nerve agents. Again, like I was saying, sludge, salivation, lacrimation, urination, defecation. I don't remember what G is. Gastrointestinal something. And then emesis is vomiting. I can't remember offhand what G is. So we have one drug in our drug box, which is an anticholinergic, aka atropine. The problem with atropine is it will dry out everyone, and it will also increase the heart rate in adult patients. It doesn't actually work in peds, which we'll talk about later. I think tomorrow we go over that. Anticholinergics, specifically tricyclic antidepressants, cause this. Opioids. Now, opiates refer to anything that's naturally derived from opium. In other words, the poppy seed, like heroin, morphine, or opium itself. When we're talking about opioids, we're talking about synthetically derived chemicals. They have the same effects, but they're not derived from opium directly. Codeine, oxycodone, hydromorphone, Dilaudid, good old Dilala, respiratory depression, CNS depression, meiosis. How do we treat those? Good old-fashioned Narcan. It works like a charm. How does it work? Your body loves opiates and opioids. Your body wants them. It craves them. It would love to just live on them 24/7. But for some reason, it's slightly more attracted to Narcan, even though Narcan doesn't get it high. So it's just proof that our bodies aren't addicted to the feeling of getting high. Our bodies are just addicted to fulfilling their chemical bonds so that we can get the serotonin and dopamine release in our brain so that we get rewarded. It's not so much how our body actually feels. Narcan will get you that way. But as you guys will know, anyone who's been given Narcan is not going to be feeling very good or be very happy at all. One second. All right. Sympathomimetics, again, cocaine, methamphetamines, epinephrine. These are going to cause hypertension, tachycardia, tremor. Also think about effects we're going to see on the eyeballs. Dilation. How do we treat these? Usually with nothing. We need to be worried about hyperthermia. So cooling them down will be helpful because it's very likely that someone on meth, PCP, crack can raise their body temperature and then can start to overheat. And that can cause lots of problems. So we might need to sedate them with benzos if it's like an excited delirium case. Most of the time, just calming them down, reducing the sensory input, actively cooling them down will be plenty. GABA agonist withdrawals. This is withdrawals from alcohol, benzos, barbiturates, other drugs. Think about the effects that will have: tremors, agitation, delirium, seizures, tachycardia, hyperthermia, hypertension. Again, also treated by benzos, although this is mostly supportive. This will happen to a lot of chronic alcoholics. What happens is your body becomes reliant on alcohol. There's a couple stages that happen with toxicological effects, right? The first is it feels good. I love the show Community because they did a really good show where they had to do a skit on drugs. And I think they actually nailed it, because drugs, the reason we do them is because they make you feel good, right? They do. And the next time it's going to take a little bit more to feel that good. And you're never going to feel that good again, honestly. You're going to try to chase that high forever, and you're never going to be able to quite get it. Then it's going to take more and more. And then at that point, you're rewiring your brain to only respond to that. And all of a sudden, nothing else you do is going to give you that same amount of pleasure that you got just from taking that one drug. The number one offender of this is definitely heroin. I don't really care if people use drugs. I don't personally use any drugs. I don't even drink anymore. I used to drink, but I don't drink anymore. But I don't care if people use drugs, honestly. I live in California. Everybody smokes weed. That's fine. But the problem with drugs is if you're using these things regularly, you're rewiring your brain and you're destroying the normal reward passageways. Your dopamine and serotonin levels are not good unless you're getting high or unless you're fulfilling that addiction. This is the problem. And now when we get off of it, the withdrawals happen. People withdraw from weed as well. I know because I used to smoke it and then I stopped. And I used to smoke very heavily when I was in college. Like, full disclosure, I don't anymore, because when I stopped, I felt terrible. And it was because my brain had been completely rewired to only respond to this one stimuli. It took probably like 2 months for me to feel normal again. And now my brain works just fine without any of those stimulants. And that's definitely the effect I would recommend to you guys or any of your friends that use those drugs. Nothing wrong with them, but you're better off without them. You don't need them. Opioid withdrawal is going to be very similar, except a lot harder. Okay. There's no reason for anyone to ever use heroin, because I don't know very many people that have successfully quit heroin. I know a lot of people that use heroin, and by that I mean my patients working downtown San Diego. I have only met a handful of people that have successfully quit heroin, and even of them, all of them were still taking I can't remember the name of it. What's the drug that they'll give you when you're oh my gosh, I'm drawing a complete blank. Methadone. Yes, thank you, Molly. I was drawing a blank on that. Yeah, they'll be on methadone 15, 16, 17 years later, because your body is never going to stop craving it. You can rewire a lot of your brain passageways, but it's hard, especially if you use these drugs before you turn 25. When you hit 25, your brain is fully developed. All those neuronal passageways are fully formed. You can get smarter after 25. You can even change some habits after 25, but the major portions of your brain are finished. So if you're considering using any of those drugs, I would recommend not before you turn 25, please, because they will affect your brain in very negative ways. So again, we just talked about that: addiction, then dependence. This is where if you stop using it, you'll start to experience the withdrawal symptoms. And then finally, we reach tolerance, which is where we need more and more and more in order to get the same effects. What can cause hypoxia and hypoxemia? Remember, hypoxemia we can measure. Hypoxia is just an effect we feel. Asphyxiation, not breathing or swallowing things down the trachea, blocking it off. Carboxyhemoglobin, which is inefficient use of the hemoglobin, and methemoglobin. This is when we combine with carbon dioxide. It forms, I have one of those two, and then the other one forms with something else. Either way, it's not transferring oxygen. Hallucinogens, LSD, psilocybin, Amanita mushrooms, mescaline, MDMA, DMT. There's a ton of them. People have various feelings about how these drugs will affect us. Are there any long-term negative effects? Yes, for some of them, there definitely are. For some of them, it's not really noted. We can't really do extensive research on these drugs, which is part of the problem. We've criminalized them, and while that may or may not be the right call, it does limit our ability to test them in a meaningful and methodical way. And that's ultimately the problem with this quote unquote war on drugs, is the potential use of some of these might be very, very helpful, especially with LSD. Now, like I said, I don't use any drugs, but I do recognize that LSD has had very positive reactions with quite a few people. And it's possible that it could help actually rewire some things in the brain. And through small doses of LSD, people have actually overcome their addictions to other drugs like heroin. Does it work for everybody? Absolutely not, because everyone's brain is different. Everyone's brain chemistry is different. For example, and this is just an example about myself because I can only talk about myself because I only understand myself realistically. I have ADD. I've had pretty severe ADD my entire life. I don't have ADHD, but I do have ADD, and that may or may not shock you guys to hear. But how does that affect my brain chemistry? Well, different chemicals will affect me differently. For example, caffeine doesn't do anything for me. Literally, I could drink a giant cup of coffee and I could go right to sleep. It would make no difference. I've never drank coffee. I mean, I've drank coffee. I've tried it before. I don't drink it regularly. I don't need it to wake up in the morning. I don't need it today. I can drink it and then go to sleep. It does not have those same stimulant effects on me like it does on the average person. You can also see this with the drugs that people are prescribed for ADD, right? Amphetamine salts, very similar in their nature to methamphetamine. But as we know, that's like saying that, hemoglobin is the same as methemoglobin. Yeah, it's very similar, except it comes completely different things. So, for example, the average person that does not have ADD and does not have the same brain chemistry will take Adderall or methamphetamine salt or amphetamine salts, and they will get kind of wired, right? Maybe you guys have seen or experienced that, where you kind of get like on edge and like that, and you're jumping around and you're like super hyper focused. Does not necessarily have the same effects on someone who has ADD. It has actually a calming effect. This is why kids with ADHD, the hyperactivity disorder, are given Adderall in order to calm them down. Normally, you wouldn't think that giving a kid with ADHD crack would make him feel better, right? But it does have these effects on the brain. This is why everyone's brain is wired a little bit differently. Does that mean that people with ADD have a brain disorder? That's up for debate. Because realistically, I don't think ADD is a brain disorder. I think ADD is just a chemical difference in the brain that makes us process and think about things in a different way. The way I like to think of it is the average person moves from one thought to the next, right? And it's almost like it's like laying bricks, right? You'll put a brick down, you put another brick down, you put another brick down, and you form like a wall of bricks, one at a time. Someone with ADD is more like putting shingles on a roof. There are a lot of overlap. Because of that, it helps us draw conclusions faster. Like you hear something, your brain starts triggering other things and jumping around, and then you start thinking in this kind of cyclical way. It's really helpful for people that need to do a lot of multitasking, like paramedics, which is why I think a lot of EMS providers do have ADD. And I think that's why people with ADD are drawn to this type of work. Overdoses and poisonings. You can overdose on pretty much anything. In fact, I've seen people overdose on pretty much every pill that you can imagine. Cardiac medications are common. Usually this is just an overdose on accident, right? Someone takes their pills, they go a little bit of time, they can't remember if they've taken their pills or not that day, so they take another dosage, and now they have pretty profound effects. Calcium channel blocker overdoses. Remember I told you that calcium channel blockers are primarily used to treat ADD, as well as anything where we're having too much calcium being released in our muscles. Now, this isn't really a problem for our muscles, but it is definitely a problem for the cardiac muscles. If they overdose on these, expect hypotension, bradycardia, bradydysrhythmias. Their heart's not going to be using calcium as effectively. And we might see a prolonged, sustained release preparations ingested. Patient may present with reflexive tachycardia as well. Beta blockers reduce your heart rate. They don't necessarily activate the parasympathetic nervous system, but they do reduce your heart rate. People take beta blockers for all sorts of things, to reduce anxiety, to lower their heart rate. We can tell they're beta blockers, excuse me, because of the way that they're spelled. All of them will end in LOL. Atenolol, metoprolol, carvedilol. Those are some of the more famous ones. One side note about beta blockers that I've noticed from working here in San Diego, where I've run, I don't even know how many Narcan wake-ups. One thing that patients will do is they will mix their heroin with crushed up beta blockers, and then they will inject that so that it's lowering their heart rate so that the heroin stays in their system longer. However, this also increases the risk that they're going to overdose on heroin. Like I say, that's pretty smart thinking on their parts as far as, well, let me rephrase that. It's stupid thinking. It's smart inference and utilization of different pharmacological processes for an unjust end. Dig overdose. Now, people don't really take digitalis anymore. It's very rarely. In fact, it's probably not really prescribed in the United States anymore. However, in San Diego, I have a lot of patients from Mexico where they take all sorts of medications. I have seen it from there. Not much we can do about this. We can treat the dysrhythmias, and that's pretty much it. Tricyclic antidepressants, MAO inhibitors, MAOIs also, or serotonin reuptake inhibitors. So here's the thing. Here's what a serotonin reuptake inhibitor is. You release serotonin into, it releases from the ends of your neuronal cells, and then it will affect wherever it's trying to affect. But the serotonin that's still floating around in there will get reabsorbed into the cells. These are the reuptake drives. So we want to stop these so that there's more free-floating serotonin so that we can be happier, right? Most depression is caused by dopamine and serotonin imbalances, as well as we're starting to understand oxytocin imbalances as well. There's a lot of tricyclic antidepressants. That's the most common. Well, I shouldn't say it's the most common. All of these are prescribed in equal measures. We can treat this one though. Convulsions, cardiac dysrhythmias, and acidosis. It's primarily affected by anticholinergic effects. So we can give them glucagon and sodium bicarb. Sodium bicarb for the QRS widening, and glucagon to help reuptake certain things that they need to within their cells. MAOIs. These ones also used as antihypertensives, not necessarily for depression. Now, there's one thing important that you will experience on the quiz, which is MAOIs adversely interact with selective serotonin reuptake inhibitors, amphetamines, cheese, wine, and beer. And this is the big one, because man, if you couldn't have cheese and wine and beer, that's a sad life. I love cheese. I love cheese. I used to really like beer too. I never really was a wine drinker, but I liked beer. Signs and symptoms of these MAOI overdoses: lethargy, ataxia. Remember, ataxia means the inability to move your muscles in an organized, dexterous way. All right. Most of the way that we treat this is just going to be the supportive care, unfortunately. There's not a whole lot we can do. SSRIs, remember, those are selective serotonin reuptake inhibitors. So they only affect certain cells to keep them from reuptaking their serotonin. In massive ODs, we can see pretty exaggerated effects. However, again, there's not much we can do about this. Now, the one thing I can suggest to any of you guys is if you want to help out someone who has taken something or overdosed on something and you don't know what it is, there is a great number you can call called poison control. Does anybody know the number for poison control? I'll give you a hint. You should definitely know that number. It should definitely be programmed into your phone. There is no reason for you to not have the number for poison control as a responsible paramedic. They are amazing. If you've ever called poison control, you know exactly what I'm talking about. You'll get someone on the line almost immediately, and you can say, hey, I have a patient. He's about 180 pounds. He's 32 years old. He had, looks like, I don't know, maybe 3 or 4 grams of, let's say, gabapentin. What should I do? And they will know that. The number for poison control is this: 1-800-222-1222. I just put it in the chat window for you guys. Definitely put that number in your phones. There is no reason not to. Are you a parent? Do you have young people in your family? Do you have pets? Any of these things can be a good thing to call for poison control. Now, poison control does not specialize in animal toxicology because animals process things differently than humans. Just because you're a mammal doesn't mean you can eat the same things. For example, you can't feed a dog a chocolate bar, he'll die. You can feed your baby a chocolate bar, probably won't die. So drugs will affect things differently. Also, this is kind of an interesting side note. Humans can infect animals with COVID, but animals, so far it seems, cannot infect humans with COVID. We know this because in New York, where the worst of the COVID infections happened, the tigers at the zoo got sick with COVID because their handler also tested positive for COVID. And all those tigers are suffering from COVID. But animals cannot pass it on. So it's kind of an interesting thing that happened there. I mean, terrible because tigers are kind of more on our minds now. No, so some animals can. Let me rephrase that. Not all animals can transfer it to humans. Bats can. So bats and dogs and bats and tigers and dogs are different species of animals. So it depends animal to animal to animal. What we do know, though, is dogs and cats do not. How many people touched the tiger or got close enough to pass it on? Well, it's not so much the tiger because that's kind of an isolated case and there's not that much we can do to test it. But we can see this directly with dogs. In fact, the CDC is the one that released the thing saying that dogs, or the World Health Organization released the thing saying that dogs would not be able to. I can't remember if dogs can't get it or dogs can't pass it on. I don't think I haven't read much about it. I don't own pets, so I don't really care, to be honest, whether dogs can get it or not. I don't really pet dogs. I'm not really an animal guy. Don't take any offense to that. Sorry. I know people love their pets. I don't blame you guys. Pets are wonderful, but they're not for me. Now, over-the-counter medicines can also affect, can it be very dangerous for toxicology because they're very widely available. It's very easy to get a lot of them. However, it can take quite a bit of that for it to be fatal. So, for example, does anybody want to guess how much aspirin you'd have to take? Acetylsalicylic acid you'd have to take for a fatal dose. For reference, we give 324 milligrams for chest pain. So how many milligrams do you think would kill you? Or let me rephrase that. How many grams do you think would kill you? Any guess? How many bottles of aspirin would it take to kill you? 4 grams? That's a pretty good guess. Way more than that, though, Molly. 4 grams would be 4,000 milligrams. Way more than that. Way more. About 10 times as much, honestly. It would take about 50 grams or 8 full bottles of aspirin to be dangerous or to be fatal. It would take about half of that to give you severe hepatic and liver involvement. Oh, yeah. Oh, yeah. we're going to kill the crap out of that liver. In fact, most of these patients are going to be placed on dialysis for a short while. This is one of the few cases where we can place them on dialysis for a short period of time. Dialysis for their kidney involvement to help flush those things out. It also will help the liver. We always think of dialysis as being a renal function helper, but the kidneys and the liver are very closely intertwined with their functionality. So it's going to take a lot of that to hurt you. Yeah. By the way, don't kill yourself by taking NSAIDs. Don't kill yourself by taking over-the-counter medications. That is a painful, painful way to go. Painful. Discovering the time of ingestion is of utmost importance. The best thing you can do is give someone charcoal if they've taken it rapidly. If you can get charcoal on board within an hour, we can potentiate some of those effects. Or we can mitigate some of those effects. Again, the patient might also be placed on dialysis. And here's a big one. Mucomist. Why does mucomist help with these overdoses? We don't really know. It's a very strange case. We don't really have an answer for how it works, which is kind of unfortunately the way that a lot of medications work. We just know that it does work and it works reliably in the same way time after time. But why? We don't really know. All right. Okay. Next one is interesting. This is colloidal silver. Originally sold in the 1900s as an antimicrobial medication that could cure just about anything. The FDA later recognized it's not safe for anything, but we still sell it. It'll turn your skin purple or blue, or whatever you want to call that color. This is an actual photo. This has not been doctored. He did not dye his skin. This is not a tattoo. His skin has been hyperpigmented blue because of this colloidal silver compound. This is, by the way, not good for you. Heavy metals in the body are not good for your body, right? Your body naturally has metals inside of it. Iron, obviously, is incredibly important, but there's lots of stuff in your body. It takes a long time to get rid of this stuff. So he's probably undergoing dialysis. Is what I would guess. I don't know this patient, but I've seen that photo before. Herbal medications. There's a thing you guys need to be aware of. Yeah, it is like Papa Smurf. Hey, I would interview someone if they turned blue. Herbal medications are not recognized or regulated by the FDA. They do not have to list their contents and they do not have to undergo testing. This means that you really don't know what you're getting. Okay. Do herbal supplements work? Absolutely, they do. Most medications are derived from herbal supplements. Absolutely, a lot of them work really well. We know that. We've been giving mag sulfate for constipation for years. It works for all sorts of things that we don't necessarily give it for in medical settings. Just because the FDA and modern medicine does not recognize something does not mean that it's not effective. Homeopathic medicine and allopathic medicine are very real methodologies of study with medical schools. They become doctors. Just because you believe in acupuncture and acupressure and chiropractic medicine and all these things, and the general medical community does not mean that they're not effective or that they're not safe. It just means that the FDA regulations are against them, probably because of money concerns. Honestly, the almighty American greenback dollar is what drives medical research in this company. And it's kind of sad because it's preventing us from experimenting with other alternative sources of medicine and methodologies of treatment. Realistically, it would be better if instead of taking a pill, we could change our diet, change our lifestyle, change the things that we're consuming with our mind as well as our bodies, right? You're not just changing the food you eat, you're changing the websites you visit, you're changing the Twitter people you follow, you're changing the photos you're looking at on your Instagram. If we can increase the positivity in our lives, we increase the positivity in everything. This is all connected. This is not like some pseudoscience I'm trying to spout off to you guys. This is all very real and very documentable, but it's just not very much pushed in Western methodologies. That's kind of the unfortunate truth. So the NREMT is very much against herbal supplements. I very much for them. You guys can do research and make your own calls on that. Strong acids and alkalines. Again, these are going to cause extreme damage. Both of them are going to be damaging. Acids tend to damage more of the surface area. Alkalines can slide in and permeate deeper and deeper layers. If they spill in the skin, they will burn deeper. They might not necessarily burn as bad, but they can burn a lot deeper, so the damage can be a lot more widespread. Then hydrocarbons are petroleum products. People will drink these. By the way, let's take a list here. What is the stupidest thing you've ever had a patient drink in order to get high or to get drunk? For reference, I worked near Tucson, Arizona, near a reservation. I got a guy who used to live in New Mexico where they used to not sell alcohol on Sundays because, I don't know, because of God or Jesus or something. I think that's why they do it. Anyways, him and his buddies, when they couldn't get alcohol, they would go and they would buy Aquanet hairspray and spray that into water bottles, and they'd drink that. So Aquanet hairspray is the stupidest thing I've ever had a patient tell me he would drink. Then I also treated a patient who died because he drank, what was it? Antifreeze. Yeah, he drank antifreeze. Antifreeze tastes very sweet. I don't know what Fabuloso tastes like. I mean, I love it. It's beautiful. It's purple. I love that purple drink, Molly. You know it. You had a lady drink straight from the gas pump. Jesus Christ. That sounds disgusting. When I was a little kid, and I was a stupid little kid. I mean, I'm a stupid adult, but I was also a stupid little kid. My mom would let me pump the gas, and then I was pumping it and it stopped, and I didn't understand why it was stopping. So I pulled it out and I looked right up at the nozzle and I squeezed the handle because, like, you know, that's something a stupid little kid does. So gasoline went spraying right in my friggin' eyeballs, my mouth, my nose, and everything. So I got a pretty big dosage of it. My mom, she was a nurse. So she grabbed me up and ran me to the bathroom and washed my face and mouth out really good. But yeah, that was one of the dumber things I did. You had a guy that was huffing the gold color. I wonder if the gold color is actually, there's something about the propellants for those metallic paints that maybe they need more propellants because the paint is heavier. That would be my guess. I'm sure that that's the case for gold and silver, because typically I've seen people huffing silver spray paint. I really think it has to do with you need more accelerants because it's a heavier paint, just because they use actual bits of metal. No, I've seen that. I've seen that myself, Nathan. I feel like I'd prefer silver and gold. It just would feel fancier, you know. I've never done a whippet in my life. A whippet, if you guys are familiar, is when you get, I think, high dosages of, it's like what is it? It's oxygen. Is it helium? It's something. I honestly don't know what it is, but it's like it's these little shots of something. It's compressed air. I don't, honestly, I'd have to look it up, and I don't really want that on my search history. But I went over to a friend's house back when I used to in college, and I was smoking, and this was like the guy that I would buy my weed from. Is it nitrous? All right. And everyone was sitting around. There was these tons of these little silver bottles around, like about the size of your finger, and they were putting them in this weird little thing and then like inhaling it, and everyone there was so stupid. Every one of my friends I knew that did those is a freaking moron now. I don't know what kind of effects that has on your brain, how happy it must make you feel for you to be that dumb, but Jesus, that is one stupid thing. You're right, it's nitrous oxide. Some ambulances only carry nitroglycerin and O2. No, it's nitrous oxide. It's not the same as nitroglycerin. Yeah. Yeah, no, we do keep nitro. I think it's I think in Australia, I believe it is, they use something. I don't know if it's like nitrous or it's something like that. Yeah, it's laughing gas. But there's something about the high pressure that gets it deeper in your system. I don't know. I don't think there might not be any long-term effects with it. Maybe it's just a coincidence. All my friends that did it like are so stupid now, but you know, I don't think it's worth it. Like I wouldn't want to put anything in my body that makes me that stupid, to be honest. But yeah, that's definitely something I've seen people do. The drugs I see most frequently here in San Diego are meth and heroin, which, as you guys are probably aware, they're the same drugs we see everywhere because they're the cheapest drugs and they're the worst drugs for you. Realistically, both of them will kill you. It's not going to take that long. It always makes me really sad when I see someone who's like 19, 20 or under 25 years old overdosing on heroin. I've seen that a couple of times. I had to start an EJ on this lady. She was like 22 or something, and she's like 10 years younger than me, and she was like a really pretty girl too. Like she definitely had a chance. And then she came to San Diego and was homeless and fell in with the wrong crowd and started doing heroin, and then she overdosed like within her first week. We got her back, and then I discovered her a week later, and then she was moved on to meth and still was using heroin, and I never saw her after that. I hope for the best for her because she's young. She's got a long life ahead of her, but man, that's a tough road to follow. And part of me really feels for the people that are suffering from those things, because I know that you don't just fall into that lifestyle because of one bad decision, right? And it's usually not their faults. The people that are most susceptible in our society are the people who have been forgotten by our society. And that's really something that working in EMS has brought to light for me, is that it's people that are shithead adults, for lack of a better word. Pardon my lack of empathy right now. It's because they had terrible childhoods. And they had terrible childhoods because they were raised by shithead adults who also had terrible childhoods. And it's this cyclical process that's very hard to correct. And unfortunately, it runs rampant. And most people, if they fall on hard times, they have family they can fall back to. They have friends they can. I've been homeless for short periods of time, short periods of time, like a week, a couple days. I had a car. I could sleep there. I could crash at a friend's couch. I could go back to my parents and crash there. There was always something. There's a safety net built in. People that don't have those safety nets, one thing can lead to another. It's a very problematic thing in this country. It's not just in this country, but I think homelessness is the most pronounced in this country than it is anywhere else. Methanol is a wood alcohol, industrial solvent. It's close to ethanol, which is the type of ingestible alcohol that we drink. But as little as 4 milliliters can cause blindness. So don't be drinking your paint thinners and wood solvents and stuff like that. It's not good for you. All of this, the only thing we can really do is supportive care. We can't even use charcoal on a lot of these. Isolated alcohols, hydrocarbons, isolated heavy metals, cannot use charcoal for it. They will not work. We only can do supportive care. Isopropanol is another one. This is the rubbing alcohol, right? This is one that people drink a lot. They'll drink hand sanitizer, rubbing alcohol, mouthwash, codeine, all those things. All right. And heavy metals. It's going to, like I was saying earlier, it takes a long time for us to eliminate heavy metals from the body. Also not recommended for charcoal. You can see where we're storing it is in these white lines. That's where it's being stored. All that's metal deposits. Think about it. When you guys get an x-ray taken and there's pins, they're bright white, right? Bones are kind of this grayish color. This whiteness here, that's where the metal is going to deposit. And it kind of makes sense, right? This is where red blood cells are being produced. So this is where we would normally shuttle all that extra iron content in order to, and the hemoglobin. So we would expect this to be a little bit more prominent with metals, but not to this extent. It really shouldn't be noticeable. I think this is like a normal, actually, this is probably a pronounced one. A lot of kids in the US have high lead levels. Not so much anymore. Thankfully, we've pretty much taken care of that. Or we've taken care of the source of it. It's going to take a long time for these lead levels to deplete because it takes a long time to get rid of those problems. Our body's not very good at getting rid of it. Again, the treatment is only supportive. That's all we can really do. And this is where lead will deposit within the body as well. Mercury, I believe this is one of the last ones here. Mercury, maybe you guys, if you're a little bit older, you might remember. My mom tells me that she used to play with mercury when she was a little girl because it's a very interesting metal. It's almost liquid at room temperature, and it's got a very interesting feel, and it reacts very interestingly. As you guys know, we use the movement of mercury to get pressure readings. The partial pressure is given in millimeters of mercury, which means how much mercury will rise in a glass vial when it undergoes certain amounts of pressure changes or temperature changes. We use mercury in thermometers. Mercury works very reliably in terms of chronometry. It does not work well in the human body. They used to be getting a lot higher levels of lead and mercury and silver poisoning. That's why we used to have the phrase "mad as a hatter." And then when Lewis Carroll wrote Alice in Wonderland, he made the Mad Hatter, because hatters used to use mercury. I'm not sure what they were specifically using mercury for to create hats, but they were using mercury and other heavy metals, and a lot of them would end up kind of developing this form of dementia, brain disorders, because of all that heavy metal exposure. The only thing we can do is chelation therapy. You guys gotta chill out. No, it's different. It's a chemical injected in the bloodstream that binds to those metals: lead, mercury, copper, iron, arsenic, aluminum, calcium. Yes, calcium is another thing it will bind to. No, calcium is not a metal. Food poisoning. Montezuma's revenge, as we call it in Tucson, Arizona. Usually caused by salmonella, E. coli, staph, Shigella, different things in the food. Undercooked food is usually the worst cause of this. I've had food poisoning once in my life. It's different than getting sick from eating food. You know the difference if you've had food poisoning, because the difference is like a trickle of lava from a volcano versus Mount St. Helens eruption, if you guys know what I mean. If you've ever had a colonoscopy and you've taken Go Lightly, if you guys have ever had a colonoscopy and they've given you that little gross stuff called Go Lightly to take, I haven't personally experienced this. I watched both of my parents go through this process. Go Lightly is something that they should be using to torture people. It will literally make you explode out of your ass like you would not believe. You will go to the bathroom pretty much constantly for hours. It's amazing. Botulism. Botulism is more common in the United States than most other countries because it's caused by improperly canned goods. And in the United States, we have this fixation on home canning that most other countries don't do. So we actually have quite a few of these cases here. Try to avoid getting close to the botulism is the best way to do it. And lots of poisonous plants in the United States. Plant poisonings are second in the number of poisonings. The first, cleaning solutions, mostly kids drinking on accident. Like I said, antifreeze, drain cleaners, stuff like that. They give them these kind of acetones, or there's these sweet smells so that they don't smell terrible. But unfortunately, kids, they're bright colors and they smell good, so kids will drink them. The treat is always going to be supportive. You can always call poison control and check if charcoal would work. And for inhaled poisons, we just need to get them out of the area. Be careful of them off-gassing their stuff through their clothes. That some of that will get stuck next to their skin, and then when they move, it'll expose through their clothes. Then onto other poisons like cyanides. Again, the way that we're going to treat these are going to be cyanide antidote kits. We have a couple different ones. the scope of which we don't really need to cover within this class. Then there are also irritants. A lot of these were used as chemical warfare weapons at one point or another. They're also very easy to obtain, which is why we're going to talk about them when we talk about terrorism and bioterrorism and those sorts of things. Might be that we need to use certain precautions, and bronchodilators are generally the way that we want to treat those. All right, moving on to envenomations. Envenomations obviously refer to any sort of animal that can sting you and leave some sort of effects. Most animals, when they bite, they have poisons. They're hemolytic poisons, meaning they will destroy red blood cells. This is extremely dangerous if you are like a small bug or a bird or an insect or a lizard, or you weigh less than 1 pound. As human beings, realistically, none of these things are going to kill us. Now, they can cause severe localized infections and localized damages and necrosis, and we could actually lose hands, feet, fingers, things like that. But realistically, it takes quite a bit, quite an extreme dosage for these to be deadly. Even in some of the most deadly snakes you guys can think of, pit vipers, so cobras, rattlesnakes, the most deadly poisonous snakes, even then, one bite is not going to kill the average person. One bite might kill a dog. One bite will probably not kill an adult human. Now, the people that are at bigger risk are old folks and peds, because they have less mature, or they have less effective immune system responses. Yes, a good general rule of thumb is that they're all poisonous, but there's a couple of them that are more poisonous. So like I was saying, most of them release hemotoxins, which are toxic to our blood. There are a few that release neurotoxins, and those are the ones that we're going to really cover. Those ones are the black widow and brown recluse spiders, and then there's only one snake. Only one snake. Every other snake releases hemotoxins, except for the coral snake, which is that red touches yellow, kills a fellow. Red touches black, venomous lac. Maybe you guys have heard that that rhyming scheme before. It's one of those red, black, and yellow snakes. There's one that's extremely deadly, and then there's one that's not deadly at all. So, and they look pretty much the same. It's just the order of their stripes, which makes me wonder if ever a snake could be born with its stripes in the wrong order. I mean, it seems like that would happen occasionally, right? So, like I said, or like Phil was saying, yeah, they're all poisonous. Hymenopteras, these are stings from bees, wasps, hornets, or what were those, the murder hornets? Is that what they were called? I don't even, I think I all got lost in the news. The murder hornets that were coming in, you know, when it rains, it pours. Fire ants are also Hymenoptera as well. 3 in Washington. There were 3 murder hornets, or 3 cases? Like, how many hornets are flying around in Washington murdering people? Goodness gracious. Anyways, I didn't read too much about the murder hornets. That almost seemed like a joke, but it's very serious. It's hysteria, absolutely, but we're America, man. We feed on hysteria, don't you know? Now, fire ants were originally introduced to the United States in the 1930s through ports in Alabama coming in from Brazil. And it turns out they really like it here. Like all immigrants that come to this country, there's a lot of really wonderful things to stay here for. And fire ants felt the same way. So they spread all over those southern United States. Now, this is where they used to be located in 1996. This is an updated map. So as you can see, they love it here. All of you guys, I'm sure, have been bitten by a fire ant at one point in your lives, and you can probably agree with me that they suck. They suck thoroughly. There is no good reason to have fire ants. That being said, there's this guy on YouTube, one of the best YouTube channels I've followed. He loves ants. He has ant farms, and he raises the most violent varieties of ants that exist, the biggest, most poisonous, most like deadly fire ants that he can find. And to be fair, his YouTube channel is amazing. I can't remember the name of it offhand right now. If you guys want at the end, I can look it up. I don't like ants, but his YouTube channel is so informative that it's very interesting because ants are a very unique type of animal. They're not like you and me, where we have like we're automatons, meaning that I'm autonomous. I can make my own decisions regardless of what you do. But ants don't work that way. They work through these chemical receptors and they all do the same task instantly. It's very amazing how it works out. They're very weird creatures. And they just work until they die. They suck. I don't like them, but I can be appreciated by them. I can appreciate them. I don't think I'm very appreciated by them, to be honest. Second is the Africanized bee. Unfortunately, most bee populations in the United States are now Africanized bees, also known as killer bees. Killer bees do pollinate plants, but they don't pollinate the same types of plants that honeybees pollinated. They're also a lot more aggressive. But like all bees, they can only sting once before they die. The problem is they once one stings, more of them will be drawn to sting that area, which honeybees did not do. As you can see, they've also kind of taken up residence in these lower United States. Arizona, where I'm from, is the only state to have no more honeybees anywhere in the state, other than outside of like specialized like bee farms and whatever you call those things. Bee farms? I don't know. Beekeepers? Whatever. There's probably a name for them, but who cares? There's some Africanized bee stings for you guys. Wasps and hornets are capable of multiple stings. Their stinger does not come out and remove their entrails with it, so they can sting. These pictures always give me the heebie-jeebies, because why would you hold that thing in your hand? Even if it's dead, still. Look at that one. That's gross. They're disgusting. They're huge. They suck. I don't like looking at those slides. Sorry, guys. If you like looking at them, good for you. You guys can pull up all these slides on the EMS University website and read them through at your leisure. I hate those ones. Now, talk about the ones that actually matter, the ones that have neurotoxins, not hemotoxins. Like I said, the neurotoxins damage our neural cells. So these can have effects on our CNS. And if our CNS gets affected, then our respiratory rate, our vasoconstriction, and our heart rate can all be affected. These are obviously much more dangerous to us. The venom is extremely concentrated for black widows, and it's considered the most toxic of all spider bites. They suck. They all suck. Local effects will occur within an hour with pain, diaphoresis, and piloerection, aka goosebumps. Larger dose of venom will cause pain, muscle cramps, tachycardia, and hypertension. By the way, you guys, something interesting about goosebumps is goosebumps do work to keep heat if you have fur. And I'm not saying like hair, like a dog. I'm saying fur, which is different than hair. Fur is a lot thicker. Like a polar bear has fur. A lot of mammals, in fact, have fur. Think about dogs that live in northern climates, like huskies, malamutes, polar bears, Arctic foxes, minks, all those animals that like we prize for their very soft fur. What happens is they also have piloerectors in their skin, and that will pull everything closer and it will trap a nice layer of warm air close to the surface of the skin. Humans, we have very fine hair called velum, which is like kind of like that silky white hair that you see like on a child's cheek. But it doesn't matter if we get goosebumps, that's not going to trap any air. So what's interesting is the whole concept of us getting goosebumps does actually nothing to keep us warmer. Shivering will definitely keep us warmer. Goosebumps do not, unless you're like the hairy ape man, in which case it might keep you a little tiny bit warmer. But realistically, the goosebumps means that we used to have fur, but we do no longer have fur. Probably about the time that we stopped being able to produce our own vitamin D. And that's when we started being able to take it in from the sun, because we no longer had fur to block that out. If any of you guys don't believe in evolution, just study biology a little bit and you'll realize how obvious it is that we are descendant from other animals. It's so obvious. I don't know how anyone can even question it. These can cause hypertensive emergencies in patients with history of hypertension. So again, if you're already sick, these can make you more sick. We give antivenin, not antivenom, but antivenin at the hospitals for critical cases. What you need to do is wash the bite area with soap and water. No ice, no constricting band. The brown recluse, they have pinprick type bites, again, also neurotoxins. Venom from the brown recluse leads to varying degrees of local tissue necrosis, which usually develops within 3 to 4 days. There's the central necrosis of that bite. This is quite clearly on a child. So again, the danger for this is where you're bitten and how old you are when you're bitten. Now, if left untreated, we can suffer some pretty severe necrosis. This is someone who did not treat their spider bite for probably about a week at least. Now, that should show you how much damage they can do, but realistically, again, is this going to kill you? Not likely. Is this going to cause some severe local tissue damage? Oh yeah, sure. But that's what you get for hanging around spiders. Scorpions. Realistically, scorpions are not very dangerous. Scorpions are very scary looking. They're disgusting. Have you ever seen a scorpion mother holding all of its baby scorpions on its back? It will give you night terrors. Scorpions are horrendous animals. There's only one that's even slightly dangerous to humans. It's the bark scorpion, lives in Arizona. Yay, Arizona. It's kind of like the Australia of the United States. Well, I guess you could probably make another argument for Florida being the Australia of the United States too, as far as concentration of deadly animals. Diffuse pain, muscle fasciculations, and paresthesias. Severe envenomations can cause cranial nerve dysfunctions and cause nystagmus. Remember, that's the jerking of the eyes back and forth. A lot of salivation, difficulty swallowing. We call that dysphagia with a G. Dysphagia with an S is difficulty speaking, but dysphagia with a G is difficulty swallowing. Yeah. So there you go. That's what they look like. They're gross. Ugh. Sorry, guys. I really do not like bugs. Pit vipers. Now, like I said, pit vipers are the most dangerous classification of snakes. This includes cobras and rattlesnakes. All right. Those are both types of pit vipers. I guess that means those are snakes that you'd throw in a pit and then like you'd throw people in the pit if you wanted to kill them. That's a bad way to go. Yeah. So there you go. Pit vipers have a pretty big striking range, up to half of their body length. And these snakes can be easily 4 or 5 feet long, or even maybe a little longer than that. They have very poor eyesight. They rely on their very keen sense of smell. 80% of all strikes result in envenomations in humans, but all strikes should be transported due to the seriousness of the venom. Now, realistically, what's the best way to deal with a snake bite? Soap and water. Try to express as much of that area as you can. Sucking it out with your mouth is not recommended, although it does work. The problem is we're also introducing a lot of bacteria from inside of our mouths into the skin, which is not where we want it, okay? That's the problem with using your mouth to suck out the toxins. Realistically, though, it does work. You absolutely can suck the toxins out. If it's your own body, though, even if it's your own body, it's still going to release a bunch of stuff into that area that you will not go. And now you're very likely to get some tissue necrosis and localized infection that could lead to sepsis. So if you get bit by a snake and you're 5 days away from treatment, no, don't put your mouth on it and suck it out. What would the best thing you could do would be carry a snake bite kit on you, which essentially is kind of the same thing that they use. Think about cupping. You could heat up like the bottom of a glass bowl or something and then put it on there, and then it's going to try to suck as much of it out through that area as it can. Cupping works very well to reduce the amount of poison that's in the tissue. It'll actually suck it out. If you get one of those snake bite kits on the wound site within about 15 minutes, you can easily remove up to half of the poison, at least. Yes, absolutely, Phil. The number one way is to not get bit, but you know, we're already past that point here. One thing you should never do is put a tourniquet on it. Never, never, never. You get there and there is a tourniquet, you take that tourniquet off ASAP. We do not want tourniquets on it ever. Now, someone once told me that the local protocols where he worked, I can't remember where it was, said that they did want tourniquets on coral snake bites. I don't know if he was wrong about that. My guess is he was probably wrong. My advice to you and the NREMT's advice to you is no tourniquets for snake bites ever, ever. Okay? Just don't. Get that idea out of your head right now. Okay? What we want to do is we want to mobilize that extremity, but not cut off the circulation. So you can splint it so that we're not moving it. So that's going to reduce blood flow to the area. It's going to slow the time it takes to get to your system, just in case it's a CNS department. Yes, if we do put a tourniquet on it, it can cause compartment syndrome, in which case we'll need to perform a procedure known as an escherotomy, which we're going to see a picture of here in a second. So there's the bite. Again, everything distal to it, we're going to cause possibly compartment syndrome. And then this is an escherotomy. This is where we literally cut open to reduce the pressure. The problem with that pressure, again, think about glaucoma, think about diabetic retinopathy, think about obstructive shock. Too much pressure is not good for the system. Too much pressure squeezes the cells and keeps them from getting oxygenated. It's going to build up the toxins because it cannot return. This is a very realistic problem. And when this happens, it's all going to go rushing to the heart right away and probably put you into lethal dysrhythmias like VTAC or VFib. You had one of those performed on your left arm. God dang, son. Phil, weren't you the one that also had the traumatic brain injury from jumping out of from parachuting? Yeah, goodness gracious. Oh, it was from the same parachute accident. Okay, that's interesting. That's an interesting type of trauma then that happened. A toad jumper. I don't know what that means. Sorry, I've literally, I would never throw myself out of an airplane willingly. By static line, I don't know what that means either. I already know you're a badass, Phil. You don't have to prove it to me. But I don't know any parachuting terms. Hey, if I was good at anything else, I'd probably do that. But what I'm good at is reading PowerPoint slides. So what are you going to do? All right, so the Arizona coral snake, eastern coral snake are the ones that we need to worry about here. Again, it's always in Arizona. I'm telling you, Arizona gets the Australia of the United States award. Now, here's the coral snake. There's a king snake. These are not the same. Red touches yellow, kills a fellow. Red touches black, venomous lac. King snakes can also be black and white. But if you see this red, I would stay away. I'd stay away. King snakes, by the way, not dangerous at all. Not dangerous one bit. They are constrictors. Constrictors are only deadly if you're watching the movie Anaconda from the 90s. Do you guys remember that one? That was a stupid movie. That's not really how snakes work. Now, snakes have swallowed children whole, like giant constrictor anacondas. Oh yeah, that's happened. That's happened for sure, but not realistic. No, not all snakes are poisonous. I mean, it's good to assume that, but a lot of snakes are what's called constrictors. I had a king snake as a pet. King snakes actually kill pit vipers. So if you have one of these on your property and you don't kill it, they feed on rattlesnakes and other venomous snakes. So it's actually kind of in your interest to keep these guys around and not these guys. So take it as you will. You can take Phil's approach, which is jump out of an airplane, hit your head, and then hate all snakes, or you can trust certain snakes. No offense, Phil. Make no attempt to catch or kill a live snake. Don't take the snake into the ER. I don't know everything about ER nurses, but I do know one thing about them. They love snakes. Who doesn't love snakes, right? And especially ER nurses. They would love nothing more than to drop everything they're doing and deal with a snake that some go get 'em firefighter brought into their ER. I know this because I've seen them react to snakes, and trust me, they love it. Go ahead and give it a shot, guys. Tell me how that goes for you. Immobilize the location of the bite. Don't use a tourniquet. No constricting bands. Don't cut and suck. Snake bites kits work really good. We also start an IV. We always say that the solution to pollution is dilution. So giving them some fluids will help flush out, not flush it out, but will help dilute that poison slightly. No heat, no cold pats. Wash the area with soap and water. Why are we washing it with soap and water? Does that help with the snake bite? No. They just had a puncture through their cutaneous layers. You wash those all with soap and water, and then you disinfect them. That's why we're using soap and water. It's not because soap and water has any effect on the snake bite.